Question number 2. Axillary vein is formed by the union of cephalic and basilic vein and vena comitans accompanying the brachial artery and profunda brachial artery. Cephalic vein and vena comitans accompanying brachial artery and profunda brachial artery. Basilic and median cubital vein. So how is this axillary vein formed? Here in this image, you're seeing is axillary vein. You can see it's running parallel along to axillary artery. So in the arm, you can see what's happening. How is this axillary vein being formed? Have you ever realized that subclavian artery, subclavian vein, both of them, they're traveling together? Then both of them continues as axillary artery, axillary vein. Then axillary artery continues as brachial artery. Then why not brachial vein? Why don't you have a brachial vein in the arm? The reason is, first of all, there is a reverse flow of blood. Arteries carry blood away from the heart. Veins carry blood towards the heart. So now this vein, basilic vein, this basilic vein is formed on the dorsum of the hand, on the ulnar border, on the ulnar side, where the medial end of the dorsal venous arch joins the medial marginal vein. It continues as basilic vein, which continues in the front of forearm along the medial border subcutaneously. Then it becomes the content of the roof of cubital fossa, where it receives a tributary that's called median cubital vein. Now this median cubital vein is actually a branch from cephalic vein, but it's a tributary of basilic vein. Why? Let me tell you, cephalic in its entire length is subcutaneous, but basilic becomes a deep vein when it reaches on the medial side of the arm. At the mid of the arm, it perforates the deep fascia and then it becomes a deep vein. Now this basilic vein in the upper medial side of the arm, when it becomes a deep vein, it receives two vena comitants from the brachial artery, right? So there's a two vena comitants which were running along the brachial artery. They will drain into this basilic vein, now a deep vein. Then there are two vena comitantes, you can see they're running along with profunda brachial artery. Paired vena comitantes along with profunda brachial artery. So it receives four vena comitants. Two from the brachial artery and two running along the profunda brachial artery. After receiving these four vena comitants, now this basilic vein, when it reaches the lower border of teres major, this you're seeing is the lower border of this muscle, teres major, the green color I have used, right? And as per the terminology of the axillary artery, after crossing the lower border of teres major, now this basilic vein, which is a deep vein of the upper medial side of the arm, it will now be called axillary vein. Similarly, like the branches of the axillary artery, there will be the veins, and those veins will be the tributaries of the axillary vein in the axilla, and it will be crossed by pectoralis minor, numbering them as first, second, third part of the axillary vein. And after crossing the outer border of the first rib, this axillary vein will continue as subclavian vein, which will be crossing the first rib anterior. You can see in the image, it will cross the first rib anterior to the scalenus anterior muscle. Now, a little more information about the cephalic vein. The cephalic vein, you should know that it is formed in the anatomical snuff box by the union of the lateral end of the dorsal venous arch with the lateral marginal vein. There is commencement of the cephalic vein, a subcutaneous vein in the anatomical snuff box. It will continue along the lateral or the radial border of the front of forearm. It will become the content of the roof of the cubital fossa, where it gives this branch median cubital vein. Then it continues along the lateral border of the biceps brachii subcutaneously in the arm. Then it ascends up, running into the deltopectoral groove. So this course of cephalic vein you are seeing is running in the deltopectoral groove, where it will be accompanied by the deltoid branch of the thoracoacromial artery. And remember, the cephalic vein is subcutaneous throughout its length in the upper limb, and along its course it will also be accompanied by the lymphatics from the thumb and the lateral side of the forearm. You can appreciate that it crosses the pectoralis minor muscle anteriorly, the cephalic vein. So in case if it's asked sometime that cephalic vein drains into axillary vein, in which part? First, second, or third part? So remember that cephalic vein, because it crosses the pectoralis minor first and then drains into the axillary vein, so it is draining into the first part of axillary vein. And at that point where this drains into the axillary vein, there you find group of lymph nodes. and these group of lymph nodes are called cephalic lymph nodes, also called as infraclavicular lymph nodes. So remember the lymphatic drainage from the thumb and its web and along the lateral part of the forearm, this is being drained into the infraclavicular, the cephalic group of lymph nodes. And both of these structures will perforate the clavipectoral fascia to reach into the axilla and drain into these lymph nodes. So remember, where the cephalic vein dips down, that's a infraclavicular triangle or the deltopectoral triangle, from where it dips down and then perforates the clavipectoral fascia and then drains into the infraclavicular or the cephalic group of lymph nodes. So that was a short revision about this venous drainage as well as the lymphatic drainage. Remember, the rest of the lymphatic drainage of the upper limb drains into the lateral group of axillary lymph nodes. The medial side, the medial border, the primary lymph nodes may be the supratrochlear group of lymph nodes, but the efferents from the supratrochlear will drain into the lateral group of axillary lymph nodes. In short, you just remember that the entire lymphatic drainage of the upper limb drains into the lateral group of axillary lymph nodes, except the thumb and its web and the lateral part of the forearm. That drains into the infraclavicular group of lymph nodes. So now we got to know that the axillary vein is formed by the union of basilic vein and vena comitanttis accompanying brachial artery and profunda brachial arteries. Answer is choice B.